Hello.
How's it going?
Hello.
Come on in.
Knock, knock, hi. How are you?
That's how I expect everyone to
enter.
greet me as they come into the door.
How are you?
I'm doing great. Yeah.
Well, one, thank you so much for just making this happen. What many people don't know is this literally 4 whole years in the making.
I know. Yes. I feel kind of bad. It's like, 'cause I've seen the series, a few of them, and they're always amazing. And it's like I gotta do this to get this done, but time gets away from you. So
It's been a lengthy email chain, and
Yeah.
I'm just glad to make it happen. Really, it's an honor to be here.
Oh yeah, no, it's just it's I kicked the whole family out, so we got the whole house to ourselves here to kind of get this done. So
All right. Well, for the last time, at least on my channel, are you ready for your 73 questions?
I'm ready. Let's do it.
Well, let's get started. I don't think you need too much of an introduction, but what's your name?
Will Flanary. Hi everyone. Will Flanary, I guess better known as Dr. Glaucomflecken. That name is more famous than my real name, I suppose. So,
And what's your specialty?
ophthalmology.
And how many years have you been practicing?
So I graduated residency in 2017, then moved out here to Portland, and I've been here ever since. So now what is that? How many years is that? 17, 7, 8 years, almost 8 years.
That math checks out.
Yeah, something like that.
Where'd you go to undergrad?
I went to Texas Tech University in Lubbock, Texas.
And medical school / residency. Medical
Medical school was at Dartmouth. It was called Dartmouth Medical School. Now it's Geisel School of Medicine at Dartmouth. It's much more official, even though it's just, this is Dr. Seuss School of Medicine. And let's see, what else? I went to residency at Iowa, University of Iowa.
Wonderful. And did you take any gap years before going to med school?
Before med school, no. I went straight through, and yeah, maybe I should have. I don't know. No, it worked out okay.
There's pros and cons to
That's
both
right,
sides
yeah.
of it, and yes, it does work out okay. Oh, what was your favorite part of medical school?
My favorite part of medical school, I would say it was like the like 2 hours after every exam we would take. So like it was like every 2 weeks. The first couple of years of med school, we had like exams like every 2 weeks. We were on all the several different topics, right? And then once they were all done, we'd have this hour and a half testing session, and it was just like we were released to just enjoy our lives for a very brief amount of time. And so we had a lot of my classmates. We'd all go and we'd have some drinks and just decompress, and then get back at it the next day.
That's such a good answer that nobody has said, and I completely agree with you.
Oh, it was so much fun. Of all the memories from med school, I have a lot of memories. Like those are some of my fondest memories, is just hanging out with people.
All right, well, speaking of memories from med school, what specialty did you think you were going to go into on your first day of med school?
First day of med school, God, I guess if I had to choose that, I probably would have said neurology.
Okay.
I was disabused of that notion quite early on, I would say, and eventually became undifferentiated.
I was going to say, what changed your mind about that specialty?
I think, well, I mean, you could tell maybe from the neurologist in my videos that I came across some very interesting characters during med school. And I don't know, I realized there were so many options out there. There's so many different things that I kind of fell in and out of love with, and fell in love with, fell out of love with throughout the 4 years of med school. And so I don't know, I felt like I have wanted to do probably a dozen different things.
As do many med students.
I didn't come in like knowing like I'm going to be a, orthopedic surgeon who just operates on left knees. That wasn't me.
Well, did you at least know any specialties that you immediately said, not for me?
OBGYN, I would say. I liked the rotation. It was great. It wasn't for me. And I would say I had a similar thing with psychiatry, actually. I enjoyed the people there, but I gravitated to the operating room. I really did. And I got that in OB/GYN. That's why I liked it. And that was my first clinical rotation, actually. And so I was like,
it was also mine.
Yeah, it was really hard, but it was also just very exciting, like being in the hospital finally.
I agree.
And so I knew it wasn't going to be what I wanted to do, but the times when I got to go in the operating room were very exciting and fun, except for maybe the third time I was ever in the operating room. It was like a crash C-section, which was absolutely terrifying. Yeah. But it did reinforce my love of the operating room.
Absolutely. Well, getting back to the specialty you did fall in love with.
Yes.
What made you first fall in love with ophthalmology?
Well, it helps to be just a little bit of a weirdo, because it's a strange thing. It really is to devote your career to the eyeball. It's not something that you get exposure to very easily in med school, which I think is one of the big problems with it. I had no idea that ophthalmology was a thing when I started med school. That was, I just happened to get matched up with an academic advisor who was also an ophthalmologist. And within the first couple of months of med school, I remember asking her, I was like, ophthalmology, that's eyeballs, right? I had that question for her. She's like, yeah, we do eyeball surgery. And then at one point in that first year, she was like, you know what, I think I could see you being an ophthalmologist. Like she said, you're gonna go away for a while. You're gonna try all these other things. You're gonna think you want to do other things. Eventually you'll be back. And then 4 years later, I was back. So I don't know how she figured that out, but yeah. The reason, though, honestly, I love outpatient medicine. I like the pace of it. It's fast paced. It's hospital medicine. It would just made me crazy, to just not know when the end of my day was coming. And it just wasn't for me. I did not like hospital medicine. I like the outpatient world a lot more. I know a lot of people are the opposite. And then as I mentioned already, I liked surgery. I like being in the operating room, but the standing and operating for 5, 6, 7 hour surgeries. I had to do vascular surgery. That was my required surgery rotation. And man, I was ready to be done with it. And do something where I could actually sit down for a bit, and so it felt right because it was a good mix.
All right. So I'm sure there's a lot of people out there, one of which some may have matched already, some who are dreaming of matching into ophthalmology. How long does your training take after med school, just so they know?
Yeah. So it's the residency is 4 years. Now they have an integrated internship. When I went through, I did a separate internship altogether, and then went to residency for 3 years. But now most programs are integrated.
Gotcha. Did you consider getting any other degrees, like an MBA or MPH at all?
God, no. Oh my God. It's one degree's enough. It's so hard to get that one degree. Why? Come on. It takes a special person to be able to get another one. And I was, by the time, I had to make a decision, do I want to do an extra year doing something else? I was done with training. I was no, get me out of here. I'm ready to work.
Completely understandable. What would you say is the most unique part of your specialty?
Definitely the surgeries. It's, I remember trying to make the decision to do ophthalmology and in the back of my mind thinking, can I do microsurgery? It's so small. You're operating under a microscope. Can I do it? And it's absolutely a skill you can learn. That's the thing, and that's what I've come to understand just going through training. Almost any skill in medicine, anybody can learn how to do it. You can teach someone how to do surgery. And so it wasn't as scary to me once I realized that I was learning it and I could do it. And so, but it's a very unique thing. Other specialties use operating microscopes, but being in the eye, it's fascinating to be able to do some of the surgical things that we do.
Oh man, I got some questions later on.
Yeah.
Kind of going off that, but now is the time where you put on your car salesman hat and you try to sell your specialty. So why should someone choose ophthalmology?
Well, what I often tell, because I get that question a lot. So what I'll tell med students is like 3 questions to answer to know if you should be an ophthalmologist. All right, do you like surgery? Do you like eyeballs? Do you like to sit down? Really, it's like those 3 things. Like what else in medicine is there for you? Because a lot of people don't like eyes. They think eyes. There's a thing about eyes. See, I got a thing about teeth. I hate going to the dentist. Everyone's got a thing that really kind of like grosses them out, or they just don't want to do it. And some people, it's like sputum. It's respiratory secretions.
Hearing the suction.
The suction.
Yeah.
Like I could do that, but not. I mean, you're probably all about that. You probably can't get enough of the suction. But the future anesthesiologist over here. But for me, I didn't mind eyes. I love the anatomy of the eye. Like I think it's fascinating. Optics are, I mean, it's a little hard to understand. It took me a while, but I think it's fun to learn about that kind of stuff. And so, if you like the anatomy, if you like the eye, you like being in the operating room, like that's 90% of the way there to choosing ophthalmology. And so, I would say that and figuring out what you don't like.
Well, speaking of that, why should someone not choose your specialty?
Why should you not choose ophthalmology? I would say it can get a little bit monotonous, because clinic days are very. Some people might see that as a benefit, actually, that it's your days are very similar. And so I'm thinking back to some of my other rotations in internal medicine and general surgery, like hospital-based specialties. There's so much variety in what you're doing, what you're seeing patients admitted with different diseases and multi-system problems. And I'm going to try to explain this, but I'm an ophthalmologist, and so don't expect me to go into any in-depth detail about anything outside of ophthalmology. But it's the clinic days can get a bit repetitive. And so if you're constantly wanting something new and exciting, like emergency medicine is a good example, right? You never know what you're going to see. I can pretty much predict what my everyday is going to be like. And so that might just bore people. And so, if you want exciting and different and fun every single day, and ophthalmology might not be the job for you.
Gotcha. All right, now this is a question I'm so excited to ask you as probably the master of perpetuating stereotypes of different specialties.
I love it. Absolutely.
Are there any stereotypes of your specialty?
Yeah, I would say the stereotype that we try as hard as humanly possible not to go to the hospital is absolutely true. We very much don't like being there. The hospital's a scary place, Andy. It's
comforting words for an incoming resident.
Yeah, so we do get a reputation of anytime someone calls us, please send the patient to the clinic. Like we do anything we can to try to see patients on our own turf where we're much more comfortable. So there is a stereotype there, and we're also very physically weak, like microsurgery, tiny things. So of all the compare us with orthopedic surgeons who are quite strong, we don't have a lot of upper body strength.
Yeah. Well, there's gonna be some ophthalmologists out there that are very much.
I'm working on that. I've been weightlifting. I've been going to the gym.
There we go. All right. Now, this is also a fun one. With any stage of medical training, from third-year med student to the second-year resident, there's this concept of on-the-spot testing of knowledge called pimping. So, what is the craziest question you've ever been asked?
The craziest question. I got the question by a surgeon about. I had to list all those causes of pancreatitis. Do you remember that? It's on
an Anki card somewhere in the back of my head.
There's like a mnemonic.
Absolutely.
For it. Like the scorpion bite's one of them. Like of all the ones I remember, like that's of all the ones out there, it's like a scorpion bite that gives you pancreatitis.
Like the fresh step one, like
Yeah.
Oh man. I promise you I'll read up before I start.
So I vividly remember like being in the operating room and having to just to go through as many, and the surgeon, he would just let me sit there and just struggle and like silence in the operating room as I'm racking my brain trying to come up with this very important species of scorpion. I don't know. So that's the one that jumps out to me. I've repressed all those memories. You can't. Come on now.
Sorry. Look, we'll move on. So, what does an average day for you look like as an ophthalmologist?
Well, I get up and I take care of the kids in the morning. So that's my job. I make them their lunches, get them breakfast, get them off to school, and then I go on surgery days. I go in a little bit earlier, but for most of my days, I'm leaving the house at 7:30. Yeah, I talk a big talk about ophthalmologists, like only working 9 to 5. Really, I work at 8 o'clock in the morning. That's when my day starts. And sometimes I'll go a few minutes after 5. Don't tell the other ophthalmologist. We don't want to get that out there. Probably shouldn't even said it. But I'll go and, my clinics start at 8 a.m., go until around 12. Let's get a nice long lunch break, and then pick it back up in the afternoon. So whenever I operate, I operate in the morning or in the afternoon. So do a half day of surgery, and then clinic usually after that. And I work 4 days a week, which is full time for ophthalmology.
All right. So, on average, how many patients do you see in a day?
I'll see about 40. Clinic? That's clinic. Yeah, surgery. My surgery half days, usually like 11 or 12 surgeries.
Okay. And I was going to say, is it mostly inpatient or outpatient? But it seems a lot more outpatient.
Oh, outpatient, yes. And if it's an inpatient that I get a consult on, I try very hard to make them outpatient first.
Life of an ophthalmologist. So, what procedures do you do, or the most common procedures that you do?
So obviously, cataract surgery is the big one. Yeah. So I'll do mostly that. Pterygiums, I'll do a few of those. So that's like a little scar tissue growth that grows over the cornea. I'll do some superficial keratectomy, which is just kind of clearing off the front layer of the cornea for a variety of different reasons. I used to do a lot of blepharoplasties, so eyelid surgeries, take off a little extra skin here. But I have a wonderful partner who does all our eyelids. He's trained in that specifically, so I was happy to give that over to him.
Imagine being just an eyelid specialist.
Hey, a lot of things go wrong with it. They're the windshield wipers of the eye. They're important.
I'm learning so much today.
We got all kinds of subspecialties. We got like 8 different subspecialties in ophthalmology.
Well, before we dive into that, what is the most common diagnoses or problems you see patients for?
Yeah, cataract, macular degeneration, glaucoma, blepharitis, dry eye, that kind of thing.
Okay.
Yeah, that's most of it.
All right. This is also a really fun one. Any emerging tech or advancements that you find exciting or promising in your field?
Well, we got this new type of lens, this artificial lens. So when we do cataract surgery, we take out the cataract, we put an artificial lens inside the eye. And we have what's called a light adjustable lens now. So this is a lens. So one of the problems is when we put this lens inside the eye, we're using all these measurements to try to make sure it's exactly right to give the patient perfect distance vision. All right, so try to get them seeing great, seeing those street signs, seeing all that thing. But the human body is not like a calculator, right? So it's like you can do all the calculations you want, but sometimes you're a little off because the body is unpredictable in different ways. Well, now we have this lens that we can put in the eye, but then we can change the shape of it after surgery. And so if we end up a little bit off, maybe I wanted to make the patient see well for distance and they end up a little bit nearsighted. Well, I can change the shape of their lens now using this special type of lens that can post-operatively make them see perfect for distance. So it takes a lot of the guesswork out of some of cataract surgery calculations.
All right, a bunch of ophthalmologists are going to yell at me in the comments. Is this like putting a zoom, like in my head, I'm like envisioning a zoom lens, like my 24 to 70 millimeter in the eye where you can just like adjust on the fly.
No, we can't really change. There are lenses, we've had them forever. They're called multifocal lenses that give you different distances. But this is one that we can change the refractive error of the eye after surgery. We've never been able to do that before.
That's incredible.
It's pretty cool.
Right.
To me.
Well, what's one thing people misunderstand about the field of ophthalmology?
I think I have seen a big change in patient expectations now. And it gets back to actually what I was saying, that the human eye is not, it's not a computer. And also, we cannot give you 20-year-old eyes again. That's a big misconception people have about, because we've gotten so good at cataract surgery now. Like, we can do amazing things. We can give you a range of vision that you didn't have before. We can make someone who's been -8 their whole life, and all of a sudden they can see, 200 yards away and also right in front of their face. But there are limits, and in the end, it's still, like most parts of medicine, it's an imperfect science, and so we've kind of created really high expectations for ourselves as eye surgeons. But I want people to understand that nothing is guaranteed, and we do our best, but mistakes can happen. You can be a little bit off with calculations. It's not perfect.
Yeah, I think that's a great segue to the next one, which is, what is the toughest part of your job?
Taking away, telling people they can't drive. That comes up a couple times a month. Someone has had some kind of major vision loss, or they've been driving for a while, but they have terrible macular degeneration, and it's just not safe for them to be on the road. A big one is people that have had strokes, and they come back and they clearly have what's called a homonymous hemianopia, where they can't see anything off to one side or the other. When you have that, a complete homonymous hemianopia, you can't drive. It's not safe, because you will not see anybody coming off of the one side of you. Those are very difficult conversations to have, because sometimes you're taken away. You have to tell people that are otherwise physically fine to drive. They're able to think and react and do everything that takes to drive safely, but they don't have the visual requirements needed. And it can really, I've had some very tough conversations. It can get heated. It can get there can be tears. You don't understand how important that is to your ability to live your life the way you want to, and it really changes people. And so, yeah, that's tough.
Yeah. I mean, freedom of movement is kind of one of the biggest predictors of quality of life.
Yeah, absolutely.
And so, on a more positive note, what is the most rewarding part of your job?
Oh, by far, having a patient who has a terrible cataract. They see like light perception vision, or basically they can just see my hand in front of their face. They come back the day after cataract surgery and they're reading the chart. And they're 20/40, 20/30, and then they can function again. That's very rewarding.
All right.
Love it.
Now we got some quick fire number type questions. How many hours do you work in an average week?
36.
What time do you normally wake up?
6:30.
What time do you normally leave the clinic/hospital? Well, I guess clinic/OR.
We don't use the H word here.
I'm sorry, OR.
If I'm operating in the afternoon, I'll finish probably around 3 p.m. And then for clinic, I'm always done by 5.
Gotcha. How many hours of sleep are you typically working on?
Well, 6 to 7, not enough.
How many hours of sleep are you working on right now?
Oh, last night, actually, this is the first time I got to sleep in a while. So I'd say I got 8 hours last night.
It's a good day then.
Oh, yeah. I knew I was going to be doing this. I better be rested.
Nice and rested. Do you have to take call?
Yes.
Can't escape it.
No, everybody does, even ophthalmologists.
Well, we touched on this earlier, but any opportunity for further subspecializing? Apparently, we got just an eyelid
there's so much. Oh, yeah. So we got oculoplastics. We got neuro-ophthalmology. We got cornea. uveitis, retina, glaucoma. What else? Pathology, ophthalmic pathology is a thing. Pediatrics, of course, pediatrics.
Oh,
very important.
Yes.
I think that's it. That's it. That's enough, right?
Yes,
That's enough.
I think that's enough.
Okay,
I'm laughing because I have this question down.
let's hear it.
What's your favorite thing about eyeballs?
My favorite thing about, I'm so glad you asked. My favorite thing about eyeballs is that they're immune protected. So you can do a lot to an eyeball, and you can be, they're kind of like their own little system and separated from the rest of the human body in a lot of ways. And so it's a little bit easier to control inflammation. You don't have to worry too much about some certain systemic diseases, some that can affect the eyeball. But I like how it's like our own little enclosed ecosystem here. It's great.
I was like fully prepared for that to go off in super tangents. That's why I was laughing. Who are you most thankful for on your care team?
Oh, my lead technician, by far. Okay, lead technician. Actually, lead technician. I'm gonna have to choose two. Lead technician and my surgery scheduler. They keep it going. They're just. I'm so grateful for keeping me organized and on task and on time.
What's the most common medical advice you give to your patients?
I tell them not to smoke, honestly, because that's a big risk factor for things like macular degeneration, even cataracts. Thyroid eye disease, actually. So there's actually a lot. I didn't realize like how much that I might do of like smoking cessations, like topics and things. So I talk a little bit about that. I talk about eye vitamins a lot. There's a lot of things that people think about eyes. There's a lot of misinformation. I see this a lot on social media as well, that I'm constantly trying to debunk with patients. A lot of people are told they need to take like AREDS vitamins, which are for a certain severity of macular degeneration, and most people don't need them. There's also, telling people it's okay to wear glasses. Like people think glasses are gonna make your vision worse. That's something we're constantly fighting against in ophthalmology. And if you need glasses, you need glasses. Just optics, just bending light. If you need them, you need them. Wear glasses if you need glasses. There's nothing wrong with it.
Right. And what is your most impactful patient encounter?
I would say the on-call patients, because I don't see too many patients on call, but when I do, and when people have something that's going on with their eyes, it's scary, because vision is obviously very important for everyone. And so when someone has a serious problem, even if it's just like a corneal abrasion or a corneal ulcer, to even more severe things like retinal detachments, and just helping that person after hours in the middle of the night on a weekend, it's pretty rewarding, and people really appreciate it.
Of course. All right, we've talked a lot about your life at work. I was about to use the H word.
Oh, thank you.
I corrected myself. No. How about your life when you clock out? So what is your favorite thing to do when you're not working?
I like to play with my kids. We play sports, we rollerblade. I bought some rollerblades. I don't tell any orthopedic surgeons.
I was about to say, the former orthopod in me.
I know. Because my youngest daughter is super into skating, and I got her rollerblades, and she can do amazing things on rollerblades. She's 9 years old, and so I was like, I'll get rollerblades, not a big deal. I've got a longer way to fall, I'll say that. And I do not look good on rollerblades. But it's those, I love picking up doing those types of things with my kids. And that's my favorite thing to do.
As long as helmets are involved, right?
Helmet, oh, absolutely. We're running, I should have been wearing like elbow pads too, but at least helmets.
Absolutely. Now, does your family ever ask you for random medical advice?
Oh no, because my wife, she learned a long time ago that I am very limited in my knowledge at this point. Eyeball things, sure, but she has other people she can ask about. I do my best, but it's I struggle with the general medical knowledge sometimes.
Well, what's the weirdest question a family or friend has ever asked you?
I mean, like sometimes I'll have. People will know I'm an ophthalmologist, yet I'll still get questions about like bunions, just like things that are clearly very far away from my area. But I guess they just assume if I'm a doctor that I just going to have all the answers at my fingertips.
Yeah. You go to med school.
Right.
You are forever the family doc,
You are,
so.
yeah. Well, especially I'm the only doctor in the family, so there's nowhere else people to go to. But I try as hard as I can to come up with the right answer.
All right. Any pets?
Yeah, I have a standard poodle named Milo.
Favorite animal, not a dog or cat?
I like bears.
Great choice.
Yeah,
Pacific Northwest.
Bears
that
are
makes
great.
sense.
Absolutely.
Oh, if you could have dinner with anyone in history, who would it be?
Oh man. Anybody in history? Dead or alive? Anybody?
All the above. See.
I think I'd love to have dinner with Conan O'Brien.
Good choice. What would you guys be eating at said dinner?
Spaghetti.
Also, solid choice.
I don't know.
Well, favorite dish to eat?
I love all forms of tacos.
Oh, how many forms of tacos are
There's
there?
thousands of different forms of tacos.
Coffee, tea, or
Love me
soda?
some, coffee. God, coffee.
Yes.
I just had a cup of coffee. I'm thinking about it right now, actually.
How much water should you be drinking every day? And that's, I guess, do you have your nephrologist hat on?
Yeah,
or your cardiologist
only
hat
when
on?
I'm thirsty.
Good answer.
I don't know. Let's see. Water. I'd say sometimes I don't remember the last time I drank water. That's probably not healthy.
Probably not.
I don't think my urine is clear enough. I guess I'll say that. That probably tells you what you need to know about how hydrated I am on a daily basis.
We'll stick with the drink water when you're thirsty.
There you go. There you go.
Favorite meal from the place that has the inpatient cafeteria, if you have one.
We had, I'll say it, hospital. And it's been a while since I've had a hospital meal. I remember two specific meals. One was deluxe chicken sandwich day at Iowa. Fantastic. Had all the things on it. It was a beautiful chicken sandwich. Loved it. And at the VA, when we were on call, we each got one meal from the cafeteria that we called brown meal. Because everything on the tray was brown. I wouldn't say it wasn't good, but it was a camaraderie type thing. We all go there as a team, and we eat our brown meal, and just commiserated.
Resident bonding.
Right?
Yay.
Trauma bonding. Exactly.
Isn't that just medical training? All right. Favorite song at the moment?
Favorite song? I like that Stick Season song. You know what I'm talking about?
Yes.
Noah Khan?
Yes.
It's a good
Fantastic song.
Kids love it too.
Pineapple on pizza, yes or no?
No.
Okay.
No thanks.
Good.
Mm-mm.
All right. Now, I know it would be quite strange to not talk about your incredibly inspiring platform across social media where we have, or I say we, you have leveraged the power of skit comedy to touch on some of the most intense topics the medical field has to offer.
The power of skit comedy.
What would you say is your favorite character to play in your skits?
My favorite one to play... It's going to be between ortho, the psychiatrist, and neurology. I'd probably go with the psychiatrist. I love the therapy skits. They're fun.
Which is the most difficult character to play, either because the specialty's personality is like super ambiguous, or it is so far away from your own personality?
Probably the one that feels most unnatural to me is probably the pathologist.
I'm gonna say, speaking of
Tabitha, right here.
Oh,
look,
who is that?
Yes, this is Tabitha. This is the pathologist's microscope right here. Say hi, Tabitha. Tabby, we call her. She's old, you know. I'm not even sure if it works anymore. But anyway.
She's still kicking.
The pathologist is just, that character is very excited and happy and just joyful. And that is not my natural state. I'm a little bit more reserved, a little bit more introverted. So the extrovert characters are always like, it feels forced sometimes for me to play, but people really like those.
All right. Where did the whole Jonathan come from? And is he inspired by someone in particular?
So I do have a medical scribe, you know, so I started working with a scribe when I moved to my job here, and it's a game changer. It's like once you start working with a scribe, like you can't go back to a non-scribe world. And on one hand, it's just fantastic. On the other hand, it's a sign of how difficult it is to practice medicine in today's world, because like you have to have this whole other job to document things for you in order to have like meaningful face-to-face conversations with your patients. And it's 2017 was when I first really heard about a scribe and started working with one. And I wanted to, when I started making these characters, I wanted to create a scribe character, a medical scribe character. And it was going to be someone who didn't say much. It was just always there to just do whatever the doctor needed, which is not totally what a scribe's role is. I mean, they are very helpful in like retrieving things and doing some patient care stuff, and but not to the extent that Jonathan is. And so I was like, well, what I wanted it to be like something I wanted the name to sound professional, a little bit kind of like a butler. like Jeeves, you know, like something that sounded a little bit more formal. And so I went with, I don't know why, I went with Jonathan. And it's the way the ophthalmologist character says it. My loyal scribe, Jonathan. I don't know. It's like, why doesn't he go by John or Johnny? It's like, no, because it's Jonathan.
Oh, all 3 syllables are earned.
Oh yeah, absolutely. But I know the scribes I've worked with and I'm currently working with are not named Jonathan. So that's just a fabricated name.
Okay. All right. What is your most popular specialty character?
Ortho, by far. People
that makes sense.
Love ortho.
Makes a lot of sense.
Yeah, and I try to give some dimension to these characters, probably with the exception of the neurologist, but she's just like a one-trick pony. But like I try to give a little bit of depth to it and not have it be just your like stereotypical orthopedic surgeon by like, you know, he's got kind of a sweet spot to him and clearly knows bones. Maybe not anything else, but he knows bones.
It just makes so much sense.
I think that's what helps resonate these characters resonate for people is that they seem like real people. And not just caricatures.
Absolutely. Well, how do you come up with half of your skit ideas?
Well, for like the first couple of years I was doing it, it was a lot of my own experiences in med school and residency, interacting with different types of doctors. And then eventually I ran out of those ideas. I had to start doing research. Because with ophthalmology, we're so far removed from the rest of medicine that it just it got to the point where I had to get ideas from other people, or people would send me ideas. I still get emails from people that are like, "Hey, you should do a skit on this." And sometimes it's a great idea, sometimes it's not so good. But I always listen to those, and if it's a good idea, then I'll do a little research on it. Also, I just pay attention to what people are saying on social media. I follow people in different specialties on different platforms, and there are a lot of funny people out there. And so if I get like just a little idea about a conflict between like rheumatology and hematology, I don't know, some two random specialties, I see someone like getting irritated about some specific thing, I'll just kind of run with that. And so at this point now, I do a lot more research. I'm getting on old Reddit threads and doing a lot of my own research to try to figure out skit ideas. And most of that's actually I'm good at coming up with the jokes, but it's like the actual medicine part of it that I have to do research on.
Yeah. All right. Selfishly, can you give me your best anesthesia impression?
Oh, okay. Let's see if I can do this. This is our 10-foot tall blanket. Here we go.
Disappears.
This is what I would do.
Oh man.
See, it's the furrowed brow, like the surgeon just told you.
The med student is closing.
That's right. You're like the med student closed the incision. That's what I got.
All right, that one was just. All right. Okay, let me get back on track. I say, as my next question is, can you spell ophthalmology?
Ophthalmology.
Like a true ophthalmologist. Damn. All right. Let's actually get back on track. Night in person or go out on the town?
Night in.
Indoors or outdoors?
Outdoors.
Beach or mountains?
Mountains.
Would you consider yourself more of an introvert or an extrovert?
Introvert.
Was that personality trait a factor in you choosing your specialty?
Oh. No. Because there's a lot of peopling that I do.
There's quite a lot of peopling.
In most specialties, that is the case. Even if it's not patients, it's colleagues, it's other doctors. That's partly why I've avoided with certain specialties like pathology and radiology. I've tried my best to avoid the trope of like this inclusive hermit who doesn't interact or talk to people, because I don't think it's fair. And so I try to stay away from that the best I can, because it's just not, being a physician is not it's a field that introverts can do, obviously, but there is no like introvert field of medicine, in my opinion.
I completely agree.
You find your introvertedness elsewhere in life.
Also
right?
true.
Yeah. So like I do my best impression of an extrovert during clinic and during work, interacting with everybody. But then eventually you need a break, and that's the thing with introverts, right? Like you recharge oftentimes like alone by yourself. You need that time.
It's called balance.
Yeah, balance. Exactly.
All right. So again, for the last time, as we wrap up, we're almost done. I want to ask the reflective questions. So you ready?
Let's do it.
First one, what did you think you were going to be when you grew up as a kid?
Pre-junior high, I wanted to be a actor. And then I really enjoyed biology. And that's what set me on the path to medicine.
Is there a different specialty you think you could have done?
Oh yeah, I could have done radiology and pathology. I could have, God, I think the only thing I could not have done would be internal medicine. Number one, I don't think I'm smart enough. Number two, the rounding. I can't do it. I cannot do rounding. It's not physically possible for me. I would just end up laying on the floor.
I'm right there with you.
Can't do it.
There's a reason why I chose
Sorry.
anesthesia.
Yes, they're just so intellectual and they love talking. I have trouble talking for extended periods of time. I need breaks from my talking.
I think the length of this interview proves you wrong, but
this is nothing compared to internal medicine rounds.
That is true. If you didn't do medicine, what do you think you'd be doing right now?
I'd be trying to make it in comedy. Either comedy writing, acting, something like that. I've never been able to distance myself from comedy. Nor have I really tried. It's always been a really important part of my life.
Yeah. And everybody knows the path to becoming a physician, surgeon is hard. It's difficult. There's so many twists and turns to that journey. Were there any times that you doubted that you would make it as a doctor?
There were times when I thought I might not make it as an ophthalmologist. I always felt like I would get there in terms of being a doctor, but I was nervous. I was about being able to get to residency, to be able to do the specialty I wanted to do. Part of that's just of my own neuroses and being a perfectionist, and so every little misstep or every little failed test or whatever, every little mistake, I tend to really focus on, and I've had to learn how to let some of that stuff go. And then kind of the curveballs that have been thrown my way, having a testicular cancer diagnosis in med school, and that really threw me for a loop and brought a bunch of other stuff into my life. And so being a doctor, I knew I'd get there. I worked hard, I was smart, and but it's some of the other goals that I wanted to achieve that I've had doubts from time to time.
If you could change one thing about the medical field right now, what would it be?
I mean, affordable, accessible care for everyone. It's a very lofty goal, and don't ask me how to achieve that. If that's your next question, sorry.
It's not.
Because if I had the answer to that, I would make it happen. But yeah, that's what I would love to see. Especially with the more the content I've done surrounding the healthcare system. What has come with that is hearing stories from people. I get emailed. People come up to me, when I do speaking engagements, send me messages on social media, just about some of the terrible things that they have to go through, and these are things that people have to deal with when they're recovering from major medical illnesses, and the last thing you want to have to do in that moment is fight with an insurance company to get them to pay your bills that they're supposed to be paying. And so, or denials, or the prior authorization, all that stuff. And so, honestly, if there's one thing I could change, it would just to where nobody would be ruined financially just because they need medical care.
Now, what can a medical student do right now to prepare to go into your specialty?
Let's go into ophthalmology. I'll tell you what, if you can, I think, obviously, like, you got to get the good grades and stuff. And so, like, that's kind of obvious, right? You need to pass all your tests, and whatever tests still give you like a score, you got to do high on that score. I can't even keep up with it now. I feel like letters of recommendation are really important. And it doesn't have to be some from like the most famous person in ophthalmology. It can just be someone who can write a very personal, just a wonderful recommendation for you. And one way to achieve that is wherever you can do your ophthalmology rotations, learn skills, learn things like even just like checking vision, how to refract. If you can learn how to refract, you're going to be the best, the most valuable med student for the residents you're working with. And then they're going to talk to the attendings, and then you're going to get in with the attendings, and you'll get letters that way. So there's so many different little skills you can pick up in ophthalmology that are helpful in examining and eye examinations. And so if you can learn that stuff, be proactive in trying to learn it, learn people exam. Learn exam skills early on. That's going to set you up well.
Very well said. All right. So at the 2023 MCG hooding ceremony, it was an honor to have you as our keynote speaker. And obviously that was the first time I met you. And I remember specifically a part in your talk where you advocated heavily for creativity in medicine, emphasizing its impact on the world outside the clinic rooms and the hospital walls. I'm sorry for using the H word, but it's relevant here. What would you say is the impact you want to leave behind with your creative work? It's a heavy question.
It is. I've got several things. I do like trying to set an example of that as physicians we can show our true selves to people, that we can show that we have things that we enjoy outside of medicine, and we also have emotions. We also have terrible things that have happened to us in our lives, and we're not afraid to talk about it and to show the human side of being a physician. I've spent a lot of time trying to show that, and so that's one legacy I hope I can impart whenever I'm done with all the content and doing whatever it is I end up doing in my retirement. Also, to show what my life was like to my kids. When I had my cardiac arrest back in 2020, it changed a lot. A lot of my perspective on life, on what I could leave behind. And so I want to make sure they know who I am and what I enjoyed doing in life. I'm not dying or anything, but it does it does make you think about those types of things. What if Kristen had not saved my life that night with her timely CPR? What would my family, would they know who I was? Have I given enough to them to before I left? And so that's a big part of it for me, is like I like making content. I like showing who I am, not just to the world, to medicine, but also to my family, and letting them enjoy it with me, enjoying it together. It's been fun.
Completely agree. Completely agree. Now, of course, your story is so much deeper and so much vaster than just this little interview. But if you were to go back, would you change any of your experiences that got you to where you are right now?
I would still absolutely choose medicine. I'm very happy with where life has taken me at this point. Being able to combine two things I'm very passionate about and have a family, I'm very lucky. In a lot of ways, I'm very lucky. I would go back and probably, I'd start testosterone replacement therapy earlier. That's one thing. It's a whole mess of a world out there trying to navigate that kind of stuff. And I had a lot of just a terrible mood for a long time because I think I had low because of the cancer stuff. So anyway, I would have gotten on that a little bit sooner. Probably would have preemptively gone over to the hospital the night I had my little cardiac arrest. I'd saved my wife a lot of trouble. So those are two very obvious things. But from a higher perspective, I don't think I'd change much.
All right. And finally, question 73. What would you say to the aspiring ophthalmologist right now?
It's okay to get LASIK. It's a good procedure. No, that's... I would, to the aspiring ophthalmologist, this really isn't ophthalmology specific, but I would really encourage anybody, any up and coming doctor, really understand healthcare. Do your best to understand where we are in the healthcare system, the challenges that our patients face, the barriers to care. Understand that. Learn about that. You have to seek that stuff out because it's really not something we get in med school. And you learn a lot about that just being in it, practicing medicine. And we need the next generation of physicians to be really in tune about where healthcare is going right now and all the problems that we have, because that's the generation that's going to change it. And boy, do we need change in a lot of different ways. And so it's really easy to just put your head down and be like, I'm just going to do my job. But healthcare is changing around us. And if we don't have a say in how it changes, then it's going to make our jobs harder. It's going to make our patients' lives harder as well. And so we have to be, those of us who take care of patients, we have to be proactive in trying to shape healthcare.
Very well said. Well, first off, Dr. Flanary, I just want to thank you for inspiring me amongst probably millions and millions of other healthcare-related creators across the world. I want to thank you for your work on social media, advocating for, in a very tactful manner, some of the most difficult conversations that medicine has to offer. And finally, again, just a topic very near and dear to my heart. Thank you for advocating for creatives in medicine and showing many, many, many people that you can merge those two passions. As that's what this channel has been all about. And I hope that these interviews have served just as much as you say to showcase the human side of physicians.
Well, thank you for what you're doing too. Keep it up.
So, thank you. That's all I have for you. Knock, knock.